It was the whole month of February when we got bombed.
This month is an anniversary of sorts for Vietnam veteran Ron Duda.
Went through the Tet Offensive. I was in the Navy Seabees.
Though he wishes he could block out some of those images.
And I lost a bunch of friends of mine 100 feet away from me.
Now it's his sight he's worried about losing.
It was about a year and a half ago. It was a spot about the size of a small pea on the inner side of my eye. And I had to have 5 masses of cancer taken out under my eyelid.
That was in May of 2013.
And I have to fly down to La Jolla every month or two, have more surgery done because the new hospital doesn't have doctors that can perform that.
Ron moved here from Oregon because of this facility in North Las Vegas that's barely a year and a half old.
And all the doctors told me to come here. I'd have the best service in the world, but it is, but I have to go far away for it.
This hospital in North Las Vegas that came with a $600 million price tag has been called the crown jewel of the VA healthcare system. Yet instead of coming here for care, Ron has to come here where he boards a flight for San Diego.
Something he's done 8 times now to get to the VA eye clinic in La Jolla.
They actually pay for Southwest Airlines. When I was there 3 days, they paid for the Best Western Hotel.
Our tax dollars also provide a per diem for meals, plus all expenses for a caregiver to travel with him. The same goes for any other veteran who's required to have a medical attendant.
People older than me and younger than me from the different wars, and we all have to do this travel.
Contact 13 has learned 1,173 veterans were sent out of state for medical care in just the last 10 months. Of those, 36 were for emergency care. The other 1,137 were for what the VA calls non-emergent care.
We will travel our patients to where the best care is available for them.
Isabel Duff is director of the VA Southern Nevada healthcare system.
Veterans we spoke to expect that they would have been able to get any and every type of care here. Is that unreasonable?
It is. Actually, it's very unreasonable. I mean, it's very unreasonable for almost any system to provide the full range of very complex subspecialty services.
But much of what our veterans are traveling for can hardly be called subspecialty. They're sent out of state for things as common as a knee replacement.
What we do within VA is we regionalize some of that care so that we have competent, capable staff that meets the highest standards, and that's where we want our veterans to go.
If someone has a heart attack and needs bypass surgery or a stent, they get a plane ticket. Neurosurgery, organ transplant, pacemaker, plane ticket. Our VA hospital can treat lung cancer, but any thoracic surgery has to be done out of state. Veterans travel most often to Los Angeles, Long Beach, and San Diego, sometimes San Francisco.
And would you tell taxpayers it's cheaper to do it that way than to make those services available here?
I'll start with first, it's better, and second, it is cheaper.
For the last 10 months, from April 2013 to January 2014, taxpayers spent almost $1 million on airfare alone.
As this facility activates even more, as we enhance services and programs, some of the care that they may need to go out into the community for, or that they may need to travel out of state for, is going to be provided here.
Our VA hospital does already have some progressive healthcare offerings, like this state-of-the-art prosthetics lab and a high-tech mammography machine. Duff says they're on the verge of fully activating their ophthalmology program, so Ron should soon be able to do his follow-up appointments here. For now, he's scheduled to return to San Diego in April.
So what is your fear between now and April?
I just hope my cancer doesn't spread.
Because right here in Nevada, you literally have nowhere to go.
Right.
Darcy Spears, Channel 13, Action News.